Dr. Deepika Aggarwal, Senior Gynaecologist and Obstetrician at CK Birla Hospital Gurgaon. I'm going to talk about a very common women health issue called as fibroids. So what are the surgical ways to treat the fibroid? Now, as I previously mentioned, it's only very few fibroids that need treatment. The fibroids that are located inside the cavity of the womb, which we call as submucous fibroids, those are the ones that would need treatment, and they can be removed by a procedure called as hysteroscopy, which means we put the camera from inside the vagina into the uterus and we can resect the fibroid from the cavity. Then we can also do laparoscopic surgery. With the laparoscopic surgery, we can either remove just the fibroid or we can remove the whole uterus, again depending on the age of the patient, whether or not she wants children, the number of fibroids and the location of fibroid. Laparoscopic surgery is a very good mode to treat them because we hardly give any cut on the tummy. There are very small 1 centimeter, 3 or 4 incisions that are given. Recovery is very quick, blood loss is very less, and patient can go home within 24 to 48 hours. However, if the fibroids are really big, which means if they are somewhere more than 7 to 8 month pregnant size uterus, in those ones we will not have space to do laparoscopic surgery. Those are the ones where we may need to do an open procedure and take them out. So what are the types of fibroid? There are mainly 3 types of fibroid. One is which is sitting inside the cavity of the womb or the uterus, which we call as submucous fibroid. Those are the ones which usually cause most of the symptoms like very painful period or heavy period. Fibroids, the second type, may be sitting in the muscles of the uterus, which we call as intramural fibroid. Now those fibroids usually don't need treatment. They may be sitting there. However, if they start becoming very big, in that situation they may need treatment. Then there are third kind of fibroid which are sitting on the serosa, that means the outer wall of the uterus. Those are called as subcerosal fibroid, and sometimes they develop a little stalk, then we call them as pedunculated fibroid. So as I mentioned before, not all fibroids need treatment. It's just the ones which are causing the symptoms, that is the one that we need to treat. Very commonly asked questions from my patient is, can we do any change in the lifestyle by which we can prevent the fibroids, or by which we can prevent that the fibroid should not grow? Well, unfortunately, there is no natural way by which we can prevent the formation of fibroids. However, we can reduce the effect of it. For example, if we are having very heavy periods, then our iron level would be low. So I would suggest my patients to start eating green leafy vegetables, to have some iron tablets. Red meat, by increasing the estrogen body, can increase the number of fibroids or the size, so we can reduce that as well. However, what you do need to know is that fibroids are very common. 15 to 20% of women can have it. Very few fibroids would need treatment, and surgical treatment is the mainstay of treatment for fibroids if it is needed. Medical treatment can be given, but it will not take away the fibroid. It will only help to treat our symptoms. I hope you will find this video useful. Should you have any queries, please don't hesitate to contact me at CK Birla Hospital. In my next video, I will be discussing the most common myths related to fibroid. Thank you.